So welcome to our podcast on feeding your baby. Today we're going to go through the common concerns of breastfeeding and a practical guide for what to do. At the end, there's a list of places in your local area that you can contact for friendly help and advice. There are various misconceptions that are passed by word of mouth about breastfeeding. Here we dispel some of the more common ones.
Formula milk is basically the same thing.
Sadly, formula milk has a long way to go before being able to provide all of the nutrients that human milk can.
Getting my boobs out in public is unacceptable.
In actual fact, studies have shown that the vast majority of people do not mind mothers breastfeeding in public, and as you become more experienced, it's easy to be discreet. If this still puts you off, many public places such as shopping centres will often have a dedicated breastfeeding area. Tips on how to discreetly feed in public will come later in this presentation.
I can't have sex if I breastfeed.
Your sex life after giving birth to your baby is very much in you and your partner's hands. One of the hormones released during breastfeeding, called oxytocin, is actually also released during sex. Although breastfeeding is brilliant, there are some common issues mums have around breastfeeding.
I can't make enough milk.
It takes time to get breastfeeding going, and the most common reason mums give up breastfeeding is that they are not making enough milk. You might feel discouraged, but really try to keep going as breastfeeding will come eventually. The more your baby tries to suck, the more you will make for your baby.
My baby will not latch on.
If your baby is having difficulty latching onto your breast, you can try repositioning them or asking for help from your health visitor. Make sure that your baby is still well fed with express milk, and keep feeding and pumping every day to keep the milk flowing.
It hurts to breastfeed.
You may also experience some soreness when you start breastfeeding. This is very common and should become more comfortable after a few days. Some women have pain when starting to breastfeed, but don't worry, as this usually goes away. If it doesn't go away, think about going to see your doctor or health visitor. If you think you have mastitis or inflammation of the breasts, keep feeding your baby as it's safe and go and see your doctor if it doesn't go away after a day.
How do I juggle breastfeeding and work?
Many working or studying mums may be concerned about fitting breastfeeding in around a busy day, and actually many places provide facilities for breastfeeding. If you are uncertain about your workplace, it's perfectly reasonable to ask, and your health visitor might be able to help you if you're worried or concerned. Another option is to express milk for your baby when you can, which is better than formula milk, but needs a bit more planning ahead.
I have really small boobs. Can I still make enough milk?
Many ladies with smaller busts worry that they won't be able to make enough milk. This is not true, as all breasts get bigger during pregnancy and change in structure and are able to produce milk. As a mum, it's likely that you and baby will be in public places when baby gets hungry, and it's perfectly possible to breastfeed your baby in this situation. Once you get in a bit of practice, it can be really easy to make sure you're nicely covered when feeding baby and not feel embarrassed. There are special breastfeeding bras that allow easy access to the nipple, or, for a cheap and easy alternative, a loose shirt and vest can work too. Many shopping centres will have special rooms for some peace and quiet too. It's also pretty reassuring that most people out there would rather see you breastfeed than hear your baby cry. And blokes are actually pretty supportive of breastfeeding too. If you're still uncomfortable with breastfeeding in public, an alternative is to carry a bottle of express milk around, although it can be tricky to get it to your baby's favourite temperature. Remember, breastfeeding is not indecent exposure in any form, and you and your baby have full rights to nurse in public. So, you've listened and looked at how to deal with common concerns and frequently asked questions, and we hope that you make the choice that is best for both you and baby. We know the path to being a perfect mum is tricky and sometimes pretty tough. If it doesn't work out for you, please don't feel like a failure. You must make sure it's the right choice for you and your baby. Here are a few places that can give you some useful help. You can contact your midwife or health visitor, or get in touch with your GP surgery. You may also want to try Godmanchester's Children's Centre, which is available for all Huntingdon and Godmanchester mums, and the groups will be a chance to swap stories with other mums and get advice from ladies going through similar things to you. Thanks for listening, and check out our other podcasts on the pros and cons of breastfeeding and techniques and tips.